So with all of the illness, we want to talk about when you're sick. Do you wonder whether you should go to your primary care doctor or should you go to the emergency room? Dr. Eric Penniman from Summit Medical Group is here now with the answers to some of those questions. Thanks for being here this morning.
It's my pleasure.
Boy,
Thanks.
you guys are really busy right now.
Yeah, I think anybody in the medical community right now is very busy, especially the emergency rooms.
So what do you tell patients? Surely you have some patients that call in first, maybe to the nurse, and say, here's kind of how I'm feeling, what should I do?
Yeah, and that's actually what we want folks to do, is call your primary care offices, talk to the nurse, talk to your physician, your nurse practitioner, and before you just rush out to the emergency room, because they are, really, really busy, and we want to make sure the emergency rooms are there for true emergencies.
Right.
And most of the time, you're going to be better served seeing your family doctor, your internist, your primary care provider. And if they can't get you in right away, one of the express clinics is really an excellent alternative.
What are some of the symptoms that people are coming and complaining about right now?
Yeah, lots of people are having influenza-like illness. We're starting to see a spike in influenza A, strep throat, with RSV season in children seems to be starting to go down, fortunately. But now we're seeing a rise in influenza and just colds, and some people with the GI symptoms, vomiting, diarrhea. So there's a lot going around right now. So,
unfortunately, it's just that time of year. As a mom of a small child, sometimes I'm kind of struggling with, should I even take my child to a doctor? Should I call? Is this just a cold? Is it something more?
Right.
When should you start to be concerned?
Yeah, definitely. You want to, like I said, if you have questions, call your primary care office first. And then they'll give good guidance in regards to, hey, should you come in? Should you stay at home? In a bad influenza season, if you're not really, really sick, sometimes the best thing to do is stay at home and just take care of yourself. Certainly don't go in sick to work and infect everybody at the office. So preventing the spread of infection is certainly key just for our community. But from a standpoint of understanding when to go to the emergency room, really the key emergencies are if you are so short of breath you can't carry on a conversation. If you're having chest pain, if you have a broken bone that is deformed, you probably need to go to the emergency room. Bad abdominal pain, those are the typical symptoms. You should go to the emergency room. Otherwise, other symptoms that are more or less severe, I should say, really the express clinics or primary care is a great option.
All right. Now, when it comes to the flu, we know a lot of children in our area especially have the flu right now. Are we going to see more of those cases? Have we peaked yet? I mean, what's to come, do you think?
Yeah, actually, unfortunately, we have not peaked. Tennessee has been has had one of the lowest incidences of influenza, and now all of a sudden we're starting to see a peak. So whether or not we're going to have a more mild influenza season compared to last year, or if we're just going to see a late peak, only time will tell. I'm certainly crossing my fingers for a mild influenza season.
Yeah, I think we all are too. Do you think it was a smart move then by all these school districts to just go ahead and close to try to get rid of some of that bacteria?
Yeah, I mean, I think, well, and it's not bacteria, it's typically caused by viruses, but which is very, very difficult to prevent the spread, but certainly washing hands and covering your cough and things like that are very important to do. But I think it was smart, and certainly, hopefully, most people got a flu shot. That's by far and away the best way to avoid getting sick during this time of the year.
There's still time to get one? Should people
yes,
still consider
absolutely.
getting one?
Definitely come on in, get your flu shot. Most flu seasons will extend into late March, early April.
Okay.
And it takes about 2 weeks for your immune system to develop the immunity from the flu shot. So there's plenty of time still to get a flu shot.
All right. Well, thank you very much for all the tips. We appreciate it. I hope you're a little less busy in the coming weeks.
Yeah, thank you.